You're watching another episode of Shane Solomon Meets, brought to you by the Cornwall channel. I'm your host, Shane Solomon, and today I'm meeting these two lovely ladies talking everything haemochromatosis and liver. Run the titles. So, Kim and Keely, welcome to the Cornwall Channel studios. It's nice to have you here.
Hello, thank you for
having us.
Nice to be
here.
Well, it's been a long time coming. I did pop in to see you in the Victoria Inn at 3 Milestone, and you was doing a wonderful awareness. Was it a day or a week?
It was just the day that we had, but it was an awareness week, and we've all selected days to show our awareness for haemochromatosis, and we chose that day.
Absolutely. Now, so this video really is about education, certainly from my point of view, because I was diagnosed with haemochromatosis about 2 years ago. For me, my symptoms were just feeling tired all the time, quite a bit of joint pain actually, around my knuckles and knees and things like that. I'm thinking, crikey, I'm only 40. I can't be getting this old that quickly. So luckily, the doctor tested me and everything, and yes, I've been diagnosed with haemochromatosis. But Kim, I'll come to you first. What is haemochromatosis in your words, you know?
Absolutely. So very glad that we managed to diagnose you when we did, because so many people go undiagnosed and they do have those particular symptoms. And haemochromatosis is a condition where the body absorbs too much iron from the diet that we eat. So it's absorbed into the intestines and into the circulation, and then it's stored. The body doesn't have a regulator to excrete the extra iron that is stored in the body. So it accumulates in different pockets, and if untreated and undiagnosed, it can evolve into problems like the joint pains, the fatigue, and other symptoms if untreated. We all need iron in our bodies because it's an element that we do need to have to keep our bodies oxygenated. But people who are diagnosed with haemochromatosis, unfortunately, the gene deficit doesn't allow them to excrete the iron from the body, and so it accumulates over a period of time and manifests itself mainly in later life. So if you've inherited it and you've got the full genetic disposition, then it accumulates over right from the word go, from birth. You're born with that gene deficit, and it accumulates over the time, and then starting to get symptoms later in life. Usually men about 40 years of age.
Which would be about right for me.
Yes, yeah. So then you start showing signs of your joint pains, lethargy, tiredness, sometimes abdominal pain. But it can be misdiagnosed, and so can be untreated as well.
Okay, now, could you just do me a little favour, Keely, and just press cancel on that screen? We'll talk about the screen in just a moment. Now, of course, my levels of my ferritin levels and everything, when I first came to see you, was on a scale of almost 1,000, the way it's calculated. And I think a normal range is what, between 50 and 100, or what is it?
So that's absolutely right. For someone who is diagnosed with haemochromatosis, their range, we'd like them to be down to 50 or below. But for someone without that gene deficit and that gene default, the range is around about 300 for a female, and about, I think it's 200 for men. For men, yeah. So taking that into consideration, that's where the misdiagnosis is misunderstood. Sure. Diagnosis can also be achieved by a family member having already been diagnosed, and that is then shared down through the family. Sure. It's important that those family members get checked.
Indeed, well, I've let all my family know. And of course, this does affect haemochromatosis, if untreated, affect organs as well. And we'll come to you on this one, Keely. Of course, we've got these livers here, and we did a liver test just before we start recording this podcast. And my results are on the screen here now. So what was it you was doing to me in the green room?
So we were conducting something called a Fibre Scan, and I think your results are on the screen there, Shane, aren't they? Yeah. So basically, we're looking at the liver stiffness.
Yes.
So a nice normal liver, a healthy liver should be nice and soft and pliable and be able to do all its 500 functions. One that looks like this.
Oof. Yes.
It's very stiff.
Yes.
One that looks like this is medium stiffness, and then there's the healthy liver there.
Sure,
And so we were using vibration waves with our Fibre Scanner to test your liver and your colleague's liver to see how stiff your liver was, and to gauge how sort of fat or damaged they are, and that gives us sort of a baseline, really. So anybody who's diagnosed with haemochromatosis, we would give them a baseline Fibre Scan. In fact, we give anybody who's got any liver problems Fibre Scans.
Now, I had a reading of 9.3.
You did.
So I know that's not perfect, but it's also nothing too alarming, but it's health advice. Is that what you're saying?
Absolutely, yeah. So we work on a basis of fibrosis, which is the fat or the scarring in the liver. So fibrosis 0 to fibrosis 4. Fibrosis 0 is obviously no fibrosis. Fibrosis 4 is cirrhosis, which unfortunately is irreparable damage. And you would have been about fibrosis level 2, so F2. And that, fortunately, is probably a little bit fatty liver, probably some damage from the haemochromatosis, but it's still completely and utterly reversible. And, you know, our livers are wonderful organs, and they can regenerate themselves. In fact, they're the only organ in the body that can do so to a certain level. And whilst that was slightly above what we'd like it to be, it's still completely reversible with sort of health advice. So keeping to the regular units, the recommended units of alcohol, you know, healthy diet, exercise, keeping that metabolism high, you know, all the things that, you know, general health advice, really, and you would be able to get that number back down.
And it does make you think, you know, when you see this. I was very nervous, you know, having this done, because I'm like, I know I like a drink at the weekend and occasionally midweek, you know, and things like that. So I'm not the ideal patient, but and I like pasties. My partner Helen always says I've got crimping going down my side, you know, because I have so many of the darn things. But it's interesting. And just a day-to-day kind of role for you then. So your title is Decompensated Hepatology Nurse Specialist.
It is. Well done for getting that out.
That's a bit of a mouthful. Try saying that after a few pints a weekend.
Exactly.
So a typical day for you and the people you see then?
So a typical day for me, so generally I'm based at Trelisk. So I see most inpatients and some outpatients with all sorts of liver disease. So they may have haemochromatosis, which unfortunately has developed into cirrhosis, so irreversible damage of the liver. I see lots of patients who have got alcohol liver disease, and unfortunately their livers are what we call decompensated. So they're failing. They're not able to function normally, and they develop jaundice and fluid around their tummy, and they get all sorts of problems. So I see inpatients and outpatients, wide ranges, autoimmune diseases of the liver, haemochromatosis, alcohol, and lots of fatty liver. And unfortunately, fatty liver is on the rise.
Right.
And they're getting younger.
It's just lifestyle, and surely
it's
McDonald's,
purely lifestyle.
Your kind of processed
absolutely,
foods. I mean, it's
absolutely processed. Yeah. So
we hear it all the time. We know the answers, really.
We
People,
do.
You know.
But you know, it's not just your liver. I mean, you know, if we're eating unhealthily and we're unhealthy in general, it's going to affect all our organs. So we're more likely to get diabetes and heart disease, as well as our liver. But unfortunately, you know, fatty liver is on the rise.
If you can just press cancel on that again for me. And Kim, I'm going to come to you, the symptoms. So people listening to this podcast, people watching this podcast are thinking, okay, I've got the same symptoms that Shane had, but there's more. I mean, you've got a bit of a list here. Give us a few more.
And, you know, symptoms can be misdiagnosed, really. So again, it's that sheer lethargy, that tiredness, not feeling that, you know, you've been to bed, you've woken up and you're still feeling absolutely shattered. People report feeling some brain fog, and that's that not being able to think clearly, processing, or they've been able to do so much in the morning and then, you know, a few hours and they're just feeling quite exhausted and can't process the information that they would like to process. There's other things. You mentioned joint pains, and a lot of the joint pains manifest themselves in the thumb and at the base of the thumb and in the knuckles, and the feet and the knees. A lot of people report having pains there. There's an awful lot of abdominal pains, and that might be associated with irritable bowel and with the iron accumulation, because that can affect the bowel, and also obviously, you know, the liver. There's a side there. And if left untreated and undiagnosed, it can develop into further discomfort. So there's arthritis of the joints. And even once diagnosed and having the treatment, the joints still do suffer some discomfort because that's irreparable once the hemochromatosis has hit the joints. So abdominal pains. Then there's cardiac, if untreated. There's cardiac problems as well with cardiomyopathy. So if anyone feels like they're experiencing like flutters or just feeling a bit sort of, quite anxious and that sort of thing, to go to the GP and get checked out. So any combination of any real tiredness, which is unusual, joint pains, brain fog, fluttering of the heart, any skin changes, so like discoloration of the skin, like itching or tarnishing. There's a lot of individuals that come in and they say that they tan very easily in the sunshine, and that's like tarnishing, and that's one of the symptoms as well. So any of those combinations would be just to go and report that to the GP and discuss that. Diabetes can also be an end product of hemochromatosis as well.
Okay. Well, let's go down the route of how people can find out how, if they've got it.
Yes.
What's the first step?
So if they know that they have hemochromatosis, and the way that they've reached that decision of and that diagnosis is that they've been and had blood tests, or a family member might have already had a diagnosis of hemochromatosis, and then they've referred them to the GP. They will then come in and have treatment called venesection. Depending on the diagnosis, so there are different versions of hemochromatosis, but someone that had the full loading of hemochromatosis will initially come in and start venesections once a week for about 10 to 12 weeks.
And what is a venesection for people who don't know what a
venesection is? Somebody who comes in very much like a blood sample at the GP surgery, but the needle collects the blood into a big bag. It's very much like a blood transfusion bag of blood. Sorry, I didn't bring...
That's all right, no problem. We can get an extra shot of that and put it on there. In fact, I might have a shot of one of mine if you're nervous, and look away now.
Yes.
But yeah.
So we do the venesections, which is collecting of 500 mils of blood once a week, and that takes out about 200 to 250 milligrams of iron per bag. And that happens every week until we bring the levels down and we monitor those levels to go.
Because I know when I did mine, my levels were 1,000, pretty much what I said. And I don't know how many weeks. I must have done at least 3 months. I think it was about 3 or 4 months tops. And then after that, it kind of you go
plateaus
a little bit.
out.
Yes, yeah.
So then you go into like a maintenance regime and a schedule.
And of course, there is no cure to this.
There is no cure.
But we can keep it under control.
We can keep it under control. And it's not just about venesections. It's also about maintaining a healthy diet. So there's a huge debate on, at the moment, whether diet has an influence. And there's many manufacturers out there at the moment that put what we call fortified iron into food products, and that enhances the uptake of iron in the intestines when we're absorbing our products. So it's best to avoid any fortified irons. The other thing to avoid is vitamin C supplements.
Yes.
So and any products with vitamin C, because vitamin C helps to make iron. And many people that don't have hemochromatosis are advised when they're anemic to take folic acid and vitamin C to boost their iron levels. But yes, you were taking vitamin C at the time of diagnosis.
And I was taking it for a long time before diagnosis as well. Keely, I want to come back to you for just a second. It's pretty much obvious, I think we've touched on what people can do to keep their kind of livers healthy. Is there anything else that we can add to that? I mean, lifestyle is obviously right up there.
Lifestyle is probably the biggest and one of the easiest things that we can do to prevent liver disease. So, a varied diet, regular meals 3 times a day. People that have liver disease already, we say a high protein diet. But to prevent liver disease, just a general varied diet. Exercise, so increased metabolism, so making your heart work harder.
Sure. Exercise, because I haven't mentioned that.
Yeah, absolutely.
Definitely.
So quite a few of my patients are overweight and they've got fatty liver, and that's a big thing that we talk about is exercise. So unfortunately, lots of them have mobility problems, but it's just about raising that heart rate, even if it's for 1 or 2 minutes a day, just above the norm for you, so that it gets that heart pumping.
Yeah, sure. Little and often, right? All in moderation, I think, is the
absolutely.
answer to this. And I really wanted to and I really appreciate you both coming in to talk about this study, because statistically, I don't know what the last stats were I looked at, but I think they were close to like 1 in 200 people have hemochromatosis, and they don't even know it. I don't know if that stat's true, but do your own research. But it's close to that. And people might be watching this and thinking, do you know what? Yeah, I've not been feeling, myself. And that's how it started with me. Yeah. I was just, I'm not feeling, there's something,
just not right. And you do know that. You know that it's just not quite how you go
to the doctors, and luckily that doctor tested me for it and put me through for that test. Because this is the other thing, we was talking in the green room earlier on about not just testing, because both my parents got tested once I had it, and you want to make sure you're not just testing for the ferritin levels.
That's right. It's a genetic test that you need to have, really, just to exclude any genetic transference, really. Absolutely.
And it's important, sorry to interject, Kim, to let them know that you've been, or a family member has had, been diagnosed with hemochromatosis, because they don't generally test for it.
That's right.
So it's good to let them know, isn't it?
GPs are getting more aware of hemochromatosis now. There's a lot of awareness on the internet as well, to make them more aware to check for ferritin levels as well as genetic testing when we're referring patients for the symptoms that they're coming up with. Sorry.
Yeah, sure, that's right. Yeah, well, it's one of those ones for those watching the podcast. For me, as a someone who suffers from hemochromatosis, when I first got diagnosed with it, it was all that, goodness me, what have I got? Then I was panicking and all the rest of it. Yeah. But there is from my point of view, no need to panic. It's the first thing is to find out if you've got it. If you've got it, then going to see these wonderful ladies down at the medical day unit in Trelisk, if you're here in Cornwall, where they really take good care of you. You get a wonderful cup of coffee and a biscuit at the end of it, whilst you wait your 10, 20 minutes or so to make sure you're okay after having the venous section done. And it's all fine. It's one of those ones, it's just a part of your life then after that, and you see some wonderful people. And I'm one who hates needles. I hate needles, but do you know what? It's fine. It's absolutely fine. You make it really a painless process, and it's actually quite a joy to come down and see you all. Do you know what I mean? So, well, look, ladies, it's been a fascinating catch-up today. Is there anything I've missed, do you think, that we should mention, or... is there anything else I've forgotten?
I think with family members, it's important that all family members know if there's a member that has been diagnosed with hemochromatosis. It's becoming more and more evident that there are more people with the gene deficit, and more young people being diagnosed with hemochromatosis. So people as young as 16 can be diagnosed with the gene. So it's just making sure that we all know, and the family members are told, and that if you go to the GP with any symptoms, just to let the GP know, as Keely said, that you have got a family member who's also been diagnosed with it. And keeping a well and healthy lifestyle. It isn't something that can be cured, it can be treated, and it might even be that it's just once a year that you need to come in, have a venous section, and that's all that's needed to manage it.
Indeed.
I think the key is don't be frightened to get tested. It's we can help you. There's lots of things we can do. It's not curable, but it's better to get tested and treated earlier, so your liver's healthier rather than unhealthier. Because left untreated is where the problems arise, really more so than. Indeed. And I think that's probably the key.
Yes, being diagnosed doesn't mean to say you've got liver disease. It's just the undiagnosed and left untreated that can eventually cause problems in later life.
Indeed. Well, I just want to say at this point as well that my colleague Mike Spinks got scanned as well.
He did.
And he came out just over 4 point something. Which is perfect. So well done, Mr. Spinks. If you are watching this back, and Spinks' family, your Spinks is perfect with his liver. But that's it. I'm going to wrap it up for now. This doesn't mean we don't touch base again in the future. But if you are feeling any of these symptoms, just get checked out. You know, this is what we pay our NHS for. And on behalf of myself and everyone who sees you, thank you so much.
You're very welcome.
For everything you do. I know it's your job, your profession, but you go above and beyond, and we really do appreciate you. So thank you so much.
Thank you very much.
Well, look, if you know anyone doing anything remarkable here in Cornwall, please let me know. Send me an email to shane@cornwallchannel.co.uk and we can get you on the show. My thanks, as always, to Jay, who's been producing the show for us today. And until next time, it's a goodbye from me and a goodbye from these lovely ladies.
Bye.